Hi, Dr. Solari with you as we go over family systems and integrating multicultural competencies in theories of counseling, psychotherapy, and personality. So, in this section, we want to explore the concepts and techniques of family systems, understand the significance of multicultural competencies, and develop a theoretical orientation and framework for counseling. Some core concepts we want to look at is exploring genograms for family structure in history. So I would encourage you to look out what genograms are. I will describe it without a picture. But so when I look at a genogram, I'm essentially drawing a family tree. And you may have done this in an undergrad psych course. It depends. So the genogram is creating that tree, but it goes more in depth and tells you the structure of the family, if there were divorces or deaths or disagreements in the family, if there's a disconnect. So it helps you as a counselor to be able to timeline essentially this family structure and the history. And you can go, I think it was Bowen that liked to go like 3 generations. So the genogram is helpful. And some would say you should do a genogram in every single session. So keeping that in mind, like, what does that mean? What does it look like? How do I do one? Now they have nice software programs that will help you do it. And those are fascinating. So definitely a helpful modality. Other things we're looking at in family systems is reframing or restructuring that family interaction. So a lot of times you'll see family roles, and you've heard things like the hero or the little princess or the clown. Well, every family needs a clown, right? Those are dysfunctional, by the way, so sorry about the joke. So reframing or restructuring how those interactions. So if you're the family hero and you don't like that role, setting some boundaries for yourself and stepping down from that pedestal where your family puts you, and it creates a lot of pressure and discomfort. Also, another concept would be communicating. Communication probably can be taught in every session. Key figures. So these are some heavy hitters for family systems. You've got Bowen with multi-generational transmission. Satir is communication, self-esteem, and Minuchin, structural family therapy, and then Haley being strategic family therapy. Those would be for you to research more in depth, but just getting a broad structure of looking at who are the key contributing figures for these modalities or therapies. So looking at multicultural competence. So again, I think I referenced before that we have a foundations class that talks about multicultural, but this is part of the theories class as well, because it is a key piece. It's something we need to keep bringing through, that we want to respect and understand other cultures. Looking at, and I've even seen in our foundations class, people saying, even within their own culture, saying, I don't think I understood all of my own culture. I was kind of isolated in my space, and I need to see how even people from the same culture interact or do things, or maybe do things a little differently or the same. So super important for us to understand that and know that each client that comes to you, that is a key element. You may be from a similar culture, but have nuances and things that you did differently or that are kind of confusing, like, I don't know what that is. Avoiding stereotypes, that is just probably is period. Or assumptions on people or on how they did something, whether they're from a similar culture as you or not. Not stereotyping them, thinking this equals that. It's not always. We need to learn from our clients. And put ourselves aside at that time. We are in that supportive stance as the clinician, learning. We're open-minded and open to hearing something that might be different from us. Considering the socio-political and historical contexts, and then the therapeutic alliance being enhanced through your cultural sensitivity and awareness. And people will appreciate your sensitivity and your willingness to learn and not try to just seem as though you know all the things. Ask inquisitive questions. Be inquisitive, or leave the mystery in of allowing yourself to say, hey, I don't know a lot about that. Will you help me with that? Help me understand you in this context. Ongoing cultural awarenesses, just as things change in our world, we want to be adapting the interventions, or understanding how we think and feel on it, what it brings up for us. And then I'll bring in that word of countertransference. Like, is there anything being flipped around? Like, we have something going on with the client because maybe we're not as aware culturally. And then you're advocating and collaborating with your clients. So I may be advocating for them just in the room of, hey, I hear this. And it might not be anything you can change or do or step outside of your office to do, but I can advocate for them to have a voice and collaborate with them on what those next steps look like. Respecting and understanding, seeing a client's worldview, and just stepping back again. Like I said, you're in a different stance. You're just hearing, learning, respecting it, maybe not accepting it. Maybe it's so different from you that you don't want to accept that, but you can sit with them in that space and separate yourself from that and work with them professionally and therapeutically, as well as educationally. You are being trained to do this well.